did it just for us.
Kurt?
So we've got the 4 people that are available to chat with you. Sergeant Mark Sullivan, School Superintendent, Dr. Sarah Nafziger with UAB, Mayor Woodfin with City of Birmingham, and Commissioner Tyson with Jefferson County. And we'll start with Dr. Sullivan. Dr. Sullivan, each one of them will give a short statement, and then we'll take questions when we're done.
So good afternoon. I am very proud to be here with our board president, Mrs. Hendricks, at the historic A.H. Parker High School. This high school has been serving the community for over 120 years, and we continue to serve the community as part of this effort. We know that one of the best ways to end this pandemic is to ensure that everybody gets vaccinated. And so we feel like, as part of Birmingham City Schools, we want to be part of the solution. That's why we open the doors of Parker High School to give back to the community, give an opportunity for the community to have a vaccine within the city. So we are exceptionally proud of the work that UAB is doing, the City of Birmingham, and the County Commission. At this time, Board President, if you want to say anything?
Absolutely not. We just want to let everyone in the community know that this is open and will be available for you. Vaccines are very important. I've taken mine. To make sure that all of us have that same opportunity. So thank you.
Thank you.
Well, thank you. This is a very exciting day for Birmingham, for me, and for all of our team at UAB. Thank you so much for being here today. You know, shots in the arm, distributing this vaccine, that's our way out of the COVID-19 pandemic, and boy, we are excited to be here in the heart of downtown Birmingham neighborhood today. We've been working as quickly as we can with our community partners in Birmingham and Hoover to stand up 3 community sites. UAB Hospital Highlands downtown, Hoover Met, and now today here at Parker High School. To say we're eager to get these vaccines out is an understatement. We are thrilled. We continue to administer vaccines at equipment appointments are also available in the people interested in this appointment should go to uabmedicinevaccine.org and register today so that you can receive your vaccine appointment. Equity is core to UAB's strategy to put this pandemic behind us, and I can't emphasize this enough. UAB takes very seriously our responsibility to break down barriers that cause health disparities, so that we're all working to give underserved individuals the opportunity to get vaccinated. For the site here at Parker, in addition to taking appointments, UAB is working with community leaders to identify people who may not have access to all the resources like personal transportation, smartphones, computers, internet, things that make it easier for some people to get vaccinated. We want to make vaccine available to everyone who qualifies. And the last thing we want to do is make it harder for people who do not have access to resources to receive this vaccine. We will offer a limited number of unscheduled vaccination appointments each day for individuals in the community surrounding Parker High School. And we're going to expand that outreach as vaccine supplies allow in the coming weeks so that we can increase vaccine accessibility to the underserved populations who so desperately need it. Winning this fight against COVID requires a collaborative effort. We're all going to have to work together. And we celebrate our partners here today in this community, like Mayor Woodfin, Superintendent Sullivan, Commissioner Tyson, and all the others who are helping us make these vaccines more available. We appreciate each and every one of you. We're so excited to partner with you. Participation from government, civic groups, schools, faith groups, and others will be extremely helpful for us in trying to reach this vaccine. We're all in this together, and together we can end this pandemic. Thank you so much for being here today and for working with us.
I bet y'all didn't know we were reciting while the planes come, so I'll take this off to make sure y'all hear me. One, let me say good afternoon to everybody. And two, let me start with an appreciation and a thank you. Thank Birmingham and as a community what we've shown, especially with this coronavirus, touchdown not only in our globe but in our community. partnerships, we can solve anything. So the biggest thank you I can give to the Birmingham City School System, Dr. Mark Sullivan and the Birmingham Board of Education for allowing this site to happen at Parker High School. In addition to that, I want to thank Dr. Neff Singer as well as the entire UAB family for all of the things they've done, not only in 2020 as it relates to testing, but now for the access to the vaccines. And then three, I want to thank Commissioner Sheila Tyson for her heart, passion, in making sure I'm always doing what I'm supposed to do on behalf of the citizens of Birmingham. So with that, just a couple notes. One is this. Access to this vaccine is extremely important. Two, taking the vaccine. I want our citizens of Birmingham to know that many people in the community, people we trust, leaders in the community have already taken the vaccine. And I want you all to get to a point where you're comfortable taking it too. It's our job and it's our mission to provide it and to give access to it. And also, I know Commissioner Tyson will bring this up, but we are going to make sure people have to get from a transportation standpoint, get to the point where they can take this test as well. And so I'm encouraged by this partnership and thankful for this partnership. And we want you all to know this testing site exists here, right in the heart of our city, in Parker High School.
Good afternoon, everyone. First of all, I want to thank UAB, Mayor Woodford, and Director Sullivan for just including the county in on this process. It's over almost 700,000 people in Jefferson County. So we've got to make sure shots in the arm goes to everyone that wants to get one. You have a graphic in front of you now. It includes all of the cities that's in Jefferson County. We're going to put the clinics, the shot clinics, in all locations, including Bessemer, to make sure everyone have fair access to these vaccines. We want to make sure that they have no barriers. We want to shorten the process of them registering, because a lot of people in the cutoff do not have Wi-Fi. You have a poverty level here in this state that cuts the process of people because of their income. A lot of people don't have smartphones. A lot of people don't have cable. So we are going to go out and we're going to educate the community. And when I say educate the community, we're going to even go so far as hanging door knockers on their doors with the numbers, with a phone number that they can call into a phone site and register for the vaccine. We're going to have a website that the ones that do have access to a computer or smartphone can actually register. We're going to streamline the process when they register, where they don't have to go through 3 and 4 pages in order to register, because everyone don't know how to work a computer. So that's very important. And I want you to know that the county is behind this 100%. I talked to my commissioners Tuesday. They all was excited about it. They want to make sure that the citizens in Jefferson County, I can't do nothing at the county by myself. I need all 5 commissioners to be on board. They all are all in behind getting shots in the arm for Jefferson County.
We're going to take questions now, but it makes more sense, I think, to
Have
direct
any
questions,
questions?
have the individuals one at a time. So since Commissioner Tyson is up here, if you have questions for her, please bring them up now.
Commissioner, when is this effort going to kick off, getting out into the community, getting people notified? When is that going to take place, and how soon will these other vaccine spots get up? I think that's going to depend on that supply. How soon can all of this come together?
I'm going to let the doctor answer the vaccines. I'm going to answer the transportation piece that will start next week. we are going to meet Friday to actually finalize exactly what we're going to do. We already have talked to Viva, Max Transit, Class Train, Yellow Cab, church vans. We have Lyft, we have Uber. So we have talked to all of those people. They have given us the price. We do have a small pot of funding that the city of Birmingham is actually partnering on this effort with. And we have talked to the housing authority. So we have their list that's broke down by age group, by disability, and by income, to where we can make sure that we're accessing the citizens that really need this vaccine.
And the transportation will be mainly bringing people here or other locations? Once we set up the other locations, it's gonna be the closest location to them. So Uber and Lyft is a $25 Lyft code. So you will be Lyft to that code, and you have to put another code in to be Lyft back. So if we got a mobile site, they will stay in the car and they will get their shot, and Lyft will take them back to their residence. They ain't gonna take them to the grocery store and shop. Now you're going back to where we pick you up from. So they can go online, get a $25 card to cover the cost, to get to the shot, and to get home.
Yes, once they call the line and they say that they will have problems getting transportation, they will be given a Lyft code then.
And outreach into the community?
Outreach into the community is going door to door. It's nothing like face to face, because number one, we need to be educated on the vaccine. A lot of people are still thinking about the Tuskegee and everything else that our community have went through. So we've got to be educated and make sure that we understand what the vaccine is. A lot of people don't know what the vaccine is. So once we educate them, I'm telling you, I know that they will take the vaccine, but they need to be educated on the vaccine in order to take the vaccine.
When will people be knocking on doors, and who will these people be knocking on doors?
We're going to have community people knocking on doors. We're going to have people like me. I'm going to knock on doors. I welcome you to join. So we're going to have everyday people in the community that live in the community. We're going to have them knocking on doors and putting out the door knockers. And actually, we're going to buy billboards. We're going to do social media. We're going to do on the news. The mayor will cut commercials on the vaccine. We will have the doctors from UAB will be talking about it. We'll be on the radio talking about this vaccine in order to make sure we reach all of the populations. We will also be in the churches.
Commissioner, you've talked about the logistical issues, but you've also kind of hinted at something else there, right? People trusting in this vaccine. How big of an issue is that in terms of people who may be leery of trusting to get a vaccine, given the history we've seen, particularly with African Americans when it comes to stuff?
It's a huge issue. It's a huge, and it should be. Look where the vaccines went when it first came to Alabama. Went to Mountain Brook. The Jefferson County Health Department only received 500. So it should be an issue. So let's just don't go around the bush. Let's beat the bush and make sure we do address these problems that we are having in our community. Those vaccines should have came to the people who was affected by those vaccines, and the sickest community should have received those vaccines first. But we have UAB now. They're going to make sure the community get the vaccines. We have the mayor on our team. The mayor is going to make sure the communities get the vaccines, make sure the people who are affected by the COVID-19 receive the vaccines. So I have no worry now. I'm comfortable. I feel better. I can sleep at night knowing that the citizens in Jefferson County will be taken care of by Mayor Randall Wood.
Good. And the doors in the church are open.
Thank you, Commissioner.
There might be a question.
Dr. Nafziger, is UAB tracking the racial breakdown of the vaccine recipients right now?
We do track that, and I don't have that data available right now. We haven't published it yet. We're waiting on the green light from ADPH to do that. But once we have approval, we'd be more than happy to share those.
Is there any kind of broad overview you can give at all?
I don't have it today. I don't have the data today. I'm sorry.
Dr. Nessinger, exactly here, what are we looking at about numbers, vaccine doses allocated here? How long is this going to be up and running here? It was supposed to be like 5,000 per mass site, and you got 3 sites here. How does it work
Yeah,
here?
so let's talk numbers for a second. So as of this morning, UAB had administered just under 50,000 total doses of vaccine. Now we started back in mid-December with healthcare workers and EMS workers, first responder type community. So that's where we began back in December. And now today, this is where we are in our journey today, 50,000 doses later. So our vaccine allocation each week from Alabama Department of Public Health, we don't control that. They certainly control that. And the number 5,000, that was the total amount of doses that we were given this week to administer at all of our vaccine sites. Now, fortunately, we already had some vaccine available in our freezer for doses that we had already given. We were already running mass vaccinations like at UAB. So the addition of the Hoover Met site, that was adding an additional site for us. And then today, adding the Sparta site is adding an additional site. So at each of our sites, as we've begun the vaccination process, we schedule ourselves a little bit lower than we think we can handle because we want to work out the kinks in the system. We want to learn what we're doing here. We want to make sure that we've got everything as smooth as possible. Because the last thing we want to do is have cars backed up all along the street and have people, follow the traffic jam and have people delayed. So when we open up each site, we schedule lower than our projected capacity so that we can make sure that we run the site effectively. So part of that is what controls the numbers that we schedule at each site. The other thing that controls it is vaccine doses. So where are we today? To kind of give you a long-winded answer to the question. Here at Parker today, we were running our simulations. The site opens in earnest tomorrow. Today, I'm told we delivered 117 vaccine doses today here at this site, here in our simulation process. So we're going to be open tomorrow and the next day. We did have some concerns about weather tomorrow. We did have bad weather in the forecast. So we're scheduling appointments for tomorrow as we covered earlier. And we'll be open for 3 hours tomorrow and Friday. And then we're projecting to move to a full daily schedule for an 8-hour day starting on Monday of next week. I'm not sure exactly how many doses we're going to be able to give per day starting next week because some of that depends on our vaccine allocation from ADPH4 next week. We just received those numbers yesterday and the team has been working all morning in addition to working to set up the site today. Members of our team have also been working on setting the schedule for next week so we know how many appointments we can do per day. Sorry, that was a very long-winded answer.
And is it going to? These sites going to stay open continuously? And at one point, Dr. Harris thought the sites would shut down and reopen again for second doses. What is your vision, or what's happening to the 3 sites here in Birmingham?
So that's a great question. So what our preference would be, we've done all the logistics work. We put the system in place. We've hired people. We have volunteers in place. We want to keep these sites open, and we want them running at full capacity. That is what UAB wants, and all of our partners here want as well. Will we be able to do that? I don't know. The answer really depends on how many vaccine doses we have available. So we're going to have to make those decisions on a week-to-week basis because we know how many vaccines we have available. Our full intent is to keep all the sites open and to maximize their capacity. Right now, we anticipate that the sites next week will not be running at full capacity because I don't think we're going to have enough vaccine doses to do that.
Doctor, how do you decide? You have 3 locations, right, as well as serving your employees and staff internally. How do you decide how it's broken up between those different facilities when you said already it doesn't look like they're going to be able to run at full speed next week?
Yeah, so at each site we determine how many doses per day, just we're trying to smooth it out equitably. So if we have each site running at a percentage of capacity, we just try to even that out amongst the sites. We know at this site, just based on how the location logistics, it's not as big as the Hoover Met. We're not going to be able to get as many people here per day as we can in the Met. It's a big site out there. So we want to maximize our throughput here, and that'll be our first priority when it comes to appointments, is making sure that we have the maximum percentage of sites each day. That's probably going to be a big part of our decision making. Beyond that, we're just trying to make sure that we spread the doses based on demand. So, for example, one of the partnerships that we perform is with the local education community. So our internal mass vaccination site, that is our 4th site that we don't talk about as much, that's at our hospital in an auditorium. We use that for our UAV workers. We use that for our healthcare workers. We use it for first responders in our community. Now we're using that site to also partner with local educators for vaccinating children. So we're trying to balance the needs of all the different sites and make it different.
This is open for anybody, not limited to Jefferson County. Yes, vaccination.
Our vaccine sites are open to anyone who wants to register. We don't limit to the county only. That's the directions we have from the Alabama Department of Public Health, because they don't want us to turn people away. So people who qualify, who register, that's who we're vaccinating.
Commissioner Tyson mentioned these other sites going out in the community. Will UAB running those signs?
You know, that's something that we're in conversations and planning right now. You know, a few months ago, one of the members of the press asked me, when we first opened our vaccine sites, what are you doing to address those who are maybe don't have access to the internet? What are you going to do to get this vaccine to those underserved communities, the people who don't have transportation? And we were very honest at that time. I said, you know what, I don't know. At the time, we did not have a great plan. So today what we're doing is we're taking the next step in that plan by opening this community site here in the neighborhood that we know we have a lot of people who surround here who are medically underserved, who are disadvantaged, people who are disproportionately affected negatively by this virus. And so today is that next step in that. We're working on those plans. We have a lot of things in the works right now, but I can't give you the exact next step yet.
Is UAB and what you guys offer here in this county one of the reasons Walmart's not here in Shelby County? Because they're elsewhere, because maybe getting underserved areas, you guys are basically filling that void? Is that one of the reasons they're not here?
I don't know the answer to that. You'd have to ask somebody else. I really don't know the answer, to be honest with you.
Thank you.
Okay. Dr. Sullivan, if you got any questions for him?
Probably don't have any.
Doctor, I guess first off, why did you feel the need not only to get the vaccine, but to make sure that, you know, through us, that the public saw you receiving the vaccine?
So one of the things that we know is that, particularly in the African American community, the number of individuals who are being vaccinated is low. And so we wanted to take the vaccination to ensure, to show to our public that it's safe, that we have them confident in it. And we also want to encourage our educators in order to get them vaccinated. We really wanted to focus on trying to get our schools started before the end of the school year.
To combine those, many of your educators are African American. What has their reaction been? Have they been eager to receive the vaccine, or have they been skeptical?
So we did a survey, and based on our survey results, about 72% were interested in being vaccinated. Today at this school, Mr. Hudson, who's the principal here, he opened up the vaccination site as a run-through for his staff. So many of his staff were already vaccinated today. And again, I took the vaccination. I'm fine. I feel great. And I encourage anybody else who has any kind of trepidation about taking the vaccine, please take the vaccine. You know, the side effects of the vaccine are much more mild than the side effects of COVID-19.
Is this operation going to interfere with the school's operation? Baseball season starts tomorrow. Is it going to interfere?
So UAB and First Virginia have great logistics in place. We don't project any issue with that way. We don't project any issue around athletes and site.
Or school operation?
Or the school operation.
Thank you, Doctor.
Thanks.
No, I'm not bad. Sorry.
Don't have any fun.
Mr. Mayor, what will you guys be doing exactly to get more folks here, Birmingham, African Americans here, getting them literally here and letting them know what they need to do to register? What will the city exactly be doing?
So I think the communication you all saw in 2020 related to getting tested, related to social distancing, wearing face covers, and everything else we did through the use of not only TV, print, through the use of social media, through the use of teletown halls. We'll use all those same channels again and elevate that, because we think as important as it was to do social distancing, do all the other things before the vaccine was available and present for people, this is more important because this not only gets us back to our way of life, but truthfully, this is a life. I don't have to tell anybody who was listening to this that somebody at some point, we all know, family member, friend, colleague, church member, somebody in our neighborhood community has experienced either getting this and or worse death. And so I think it's extremely important through all of our channels, we over-communicate access to this vaccine, communicate this testing site. For those who are not tech savvy, it's important that we let people know the phone number that exists. We partner with B. Armstrong. We continue to partner with the Jefferson County Commission, and Chief Tyson's office, etc., who was probably one of the most effective communicators in the community about the availability of this testing site, as well as other ways outside of technology. She's already explained the whole notion of P.8B. My job is to continue to listen to those in the community who would like to offer additional resources to support that effort to get people to this testing site.
One place everyone is always together often is on Sundays. How important have you guys approached faith leaders in the community about playing a role in terms of education and then also maybe even facilitating people to see these sites?
So absolutely. So this is something Commissioner Tyson and I talked about. I think when you talk about trust in the community, the most powerful leaders have been trust our faith leaders. And I think the combination of them sharing their parishioners and their congregation the importance of getting the vaccine. But them being on the front lines, being an example. I've seen many people in our medical community, such as Dr. Dickens and others, Dr. Ray Watson, go on displays on the cameras, on social, etc., and tell the shop to let people know the leadership they can take with the trust. There would probably be nothing more powerful than our faith leaders. So I think communicating with them, we want to see you on the front line. We want to encourage you to take it. We want to encourage you to do it on public display. Encourage your members to take it. I think that's one of the fastest ways to not only build trust, but spread the word as well. Cool. That's it. Thank y'all.